How do ischemic and hemorrhagic strokes look on imaging? Imagine trying to spot the difference between two types of brain emergencies just by looking at pictures. That's what doctors do with brain imaging when diagnosing strokes. The most common initial test is a non-contrast computed tomography scan, or CORT scan, which helps quickly tell if a stroke is caused by a clot or bleeding. In an ischemic stroke, which happens when a blood clot blocks blood flow to part of the brain, early on the CORT might look normal or show very subtle signs. One of these signs is called the hyperdense vessel sign, where a blood clot inside an artery appears as a bright, white line or spot on the scan. As time passes, usually between 12 and 24 hours, the affected brain area begins to lose its normal gray-white matter distinction because of swelling caused by lack of blood. This swelling, called cytotoxic edema, makes the affected region look darker or hypodense compared to healthy tissue. Between 24 hours and 5 days, vasogenic edema develops, leading to more noticeable swelling and mass effect. The edges of the infarcted area become clearer, and the brain tissue may shift slightly due to swelling. If the stroke is old, weeks later, the damaged brain tissue shows up as dark, soft areas called encephalomalacia, indicating tissue loss and scarring. While CORT scans are quick and widely available, magnetic resonance imaging, especially diffusion-weighted imaging, is more sensitive for detecting early ischemic changes, but it takes longer and is less accessible in emergency settings. Hemorrhagic strokes, on the other hand, are usually much easier to spot on a CORT scan. When bleeding occurs inside the brain, the blood appears as a bright white or hyperdense area because fresh blood has a higher density than brain tissue. This bright spot can be seen within the brain tissue, in the ventricles, or in the space around the brain called the subarachnoid space. The presence of blood often causes pressure effects, like shifting the brain structures or compressing the ventricles, which can be seen on the scan. Because blood is clearly visible early on, hemorrhagic strokes are typically diagnosed quickly, allowing for rapid treatment decisions. Sometimes, additional imaging like CORT angiography is used to look for underlying causes such as aneurysms or abnormal blood vessels. The key point is that non-contrast CORT is the first step in stroke diagnosis because it helps distinguish between ischemic and hemorrhagic strokes. Ischemic strokes may initially look normal or show subtle signs, but over time, they develop darker areas with swelling. Hemorrhagic strokes, however, are usually obvious from the start because of the bright white blood on the scan. This quick differentiation is crucial because treatments like clot-busting drugs are used for ischemic strokes but can be dangerous if given in a hemorrhagic stroke. Always remember, imaging results should be interpreted by healthcare professionals, and they consider the whole clinical picture to decide the best course of action. If you or someone else shows signs of a stroke, prompt medical attention and imaging are essential for the best outcome.